Hello, everyone, and thank you so much for joining me on this anesthesia journey. The first thing that we're going to talk about is how to put together a balanced anesthetic protocol. And when we talk about balancing anesthetic protocols, most of the time what we're talking about is drug protocols. But that balancing issue now has kind of gone beyond, what are we going to use for pre-meds? What are we going to use for induction? How much are we going to give? Hopefully induction is always to effect, but we have to calculate out some place to start. What we're going to mostly concentrate on is how to create a complete anesthetic plan and how to balance all of the parts of that together to create seamless care and the best care that we can for each patient as an individual. So we're going to start talking about anesthetic planning, and there's a lot that goes into planning for an individual patient. We have to actually know the patient, and that's on paper. What's their lab work like? What's their history like? Is there anything that the client has added to our knowledge, whether they've kept glucose curve testing for us, or and I know clients can write down a lot of things that are really crazy and give us more information than what we want, but that on paper is usually what we get before we see a patient. And then we meet them in person. What's their personality like? Are they timid? Are they anxious? Are they fearful? And of course, if they have comorbidities, are they a cardiac patient? Or are they a renal patient? Or do they have liver compromise? Are they really large? Are they really small? Do they have a lot of body fat? And age is not a comorbidity. Age is a part of the continuing spectrum of the lifespan. However, we need to take that into consideration also when we're planning. We need to think about appropriate fasting instructions. Should we provide any type of gastric protection? Do we prescribe an antacid for our patient? What is their medication schedule like? Are they on any medications? Should they take them that morning? Should we withhold supplements that morning? What kind of supportive care are we going to need? And what's the clinic environment going to be like when that patient arrives? Then we can think about exactly what drugs we might need and what doses of those drugs. There's no good anesthetic drugs and there's no bad anesthetic drugs. They all are anesthetic drugs. It's the anesthetist that makes them good or bad, safe or unsafe. And then, of course, we need to put together a monitoring plan and a recovery plan, because there are some patients where we want to provide a full complement of monitoring to and additional types of monitoring like electrolytes or glucose. So let's talk about fasting first. And the fasting rules are actually changing based on objective data. And the American Animal Hospital Association published anesthetic guidelines for dogs and cats back in 2011. Now, that was a fair bit ago, considering that we've been doing the same thing rote over and over and over again for decades. No food, no water, long fasting times. But what we've found is that those fasting times are not necessarily in the best interest of our patient. Objective data has given us the opportunity to change fasting so that our patients are treated more appropriately as dogs and cats. They said adequate fasting is 4 to 6 hours long for dogs and cats. And then the American Association of Feline Practitioners has come and published new anesthesia guidelines for cats in 2018, said that geriatric cats, now that's cats 12 years old and older, 10 years old and older, they should be fed a small meal of wet food. Now, they didn't say volume. They just said a small meal of wet food 3 to 4 hours prior to anesthesia. And this is important to know that feeding in this time frame, 4 to 6 hours before anesthesia, 3 to 4 hours before anesthesia, does not increase the incidence of gastroesophageal reflux. What it does do is stabilize blood glucose, gives patients an energy source for the day that they're going to go through, which is a relatively stressful day. But it also helps to limit the amount of really acidic refluxate that comes out when patients do reflux.